was relieved. It is interesting to note that the Deputy Director for the Department of Health, before even the roads were open, and then again about 2 weeks later, made statements saying that there were no health effects from this release, even though he didn't know how much was released. Part of what he apparently based that on, and I'm reading newspapers now. I didn't listen to Mr. Gill himself, but part of what he based that on was apparently a belief that wind speeds during the release were extremely high, in the neighborhood of 50 to 75 miles an hour. However, reviewing all the data that's available, the wind speeds at 7:30 when this occurred, especially down low, were not particularly high. The wind speeds didn't pick up until much later, and so I'm not sure that the assumptions that Mr. Gill made in assuming there could be no health effects were in fact correct assumptions, because I think it's possible that we had a significant release, and I believe that the wind speeds were much lower than those that he quoted.
The monitors were down, and they were returned to service not until August 14th, so they were down approximately a week. And during that time, we just have readings with handheld monitors that are reading the H2S level.
DOH website has never been functional, and this is for over 20 years. I have tried over the years many times to look at that site to get historical data, and it's never worked. And we've been promised and promised and promised that that site would be worked. Could you please do something about it?
I work for the HERE office, and our website works. I'll take that back to Clean Air Branch that has that data. That's a very reasonable request. Maybe they can send someone out and work with you if you need more training on the website or get it fixed if it's broken. It makes sense. It needs to be there.
Some of the people that haven't been able to access data are PhDs.
So it sounds like a problem.
I think it's the website.
I'll take that back. I'll take that back.
Thank you. So PGV has their own internal monitors. Is there data from the internal monitors at PGV, and can we have access to it?
So the internal monitors are primarily the handheld ones that we go around with, and I believe we reported those data points to the Department of Health in lieu of not having the fixed stations in operation.
Don't you have a series of 30 or some odd little fixed monitors, things in there?
We do, and those currently do not record data.
Thank you, Mike. Thank you. Okay.
Let me elaborate, Bob. Those 30 fixed detectors is not required at all for PGV.
I understand.
It is voluntary. Okay.
The department is still investigating this incident, looking at possible violations and enforcement actions. As a result of that, those decisions haven't been made yet, but they're still investigating.
You had Cliff out there with the portable monitor, and he's reporting the highest reading at 25 parts per billion. You are aware that on March 13th of last year, the highest reading that PGV or the handheld monitors reported was 28 parts per billion, while Hazmat had a reading of 3 parts per million, or 3,000 parts per billion. So do you understand that hot steam and gases go up and over that fence and over those monitors and then come down into the community, and that if you have a 3,000 ppb in the community, and you're telling us, the Department of Health is telling us that it's not a violation of a 25 part per billion hourly average, that's not very comforting. And can you address that at all?
I understand that you're writing this, what questions you have down to provide the agency, so I can look into that. I wasn't involved in that incident, you say. I don't know the numbers, and I'm not about to make a decision on something I don't know the facts about.
That's
But
fine.
I
We'll
can
put it
tell
in
you
writing.
that if they have a permitted level and they exceed that, they should be held to that. That's what those enforcement levels are for.
But you didn't have any monitoring data, so how do you know? Okay, so I
We
won't
don't
put you on
know.
the spot.
The power was
Okay,
out. We don't know.
I understand that.
Yeah,
Okay, so I guess then I'll ask another question. Then, why, if you didn't know, did Department of Health go into the press and publicly say that there were no impacts in the community? I wanna get a real answer to the question. Thank you.
Again, perhaps since you're sending these in, I can get you a more thorough answer. But the only, and you know, I'm working on lots of issues. But the only, Tom made reference to a news article he heard about the deputy director saying something about no health effects shortly after. As far, the only one I heard about the deputy director on the news saying something, he was responding to a group of 10 or 12 people that had gone to the emergency response or hospital, and they contacted the physicians of those and asked them, you know, were there documented health effects from those checkups? And as I understand, he was speaking to that issue.
I think, did you guys jump the gun in saying that there people were out of line and complaining?
Obviously, I can't speak for the deputy director who you're addressing here, but all I can say is I imagine, knowing the deputy director, I imagine he was making statements on the best information he had at the time. We're continuing to gather data, and we'll evaluate that. And I think ultimately, take your questions, answer them to the best of our ability, and get you answers, get you questions, and try to be forthright. And
will you revise your statement? New news story that you guys made a mistake. Will you revise that?
The people that are evaluating data as we get it, if that leads to a different conclusion, wouldn't that make sense? I
would like to
To me,
rephrase.
it does.
Would you please not jump to conclusions and issue public statements like that in the future without having the knowledge? Because that has been the history of the Department of Health since 1981. That anytime there's a release, automatically there's a news story from Department of Health that says there's no health problems. Can you please not do that in the future until you have looked at the data, please?